All right, everyone, get ready for a deep dive. Today we're tackling some serious medical mysteries.
Oh, this is going to be good.
You know how I love a good puzzle?
Absolutely.
We're going to be using a fascinating case study, straight out of an Orpin microbiology textbook.
Oh, microbiology Q&A. I know that one.
That's the one. And it really shows just how wild the world of microbes and infectious diseases can get.
You said it. Things can go from 0 to 60 in the blink of an eye.
No kidding. So our case study focuses on Cora. She's a 41-year-old lawyer.
Okay, I'm picturing her.
Yeah, busy mom of two. And she gets hit with these really intense symptoms. I'm talking killer headaches.
Those are the worst.
Super high fever and a stiff neck, like she can barely turn her head.
Oof, that sounds painful.
And her husband even noticed she was acting a little confused, drowsy.
Huh, so like way beyond just a normal flu.
Exactly. Right away, you start thinking meningitis, right?
Yeah, those are some classic red flags for meningitis. When the membranes around the brain and spinal cord get inflamed, it's no joke.
And that inflammation can be caused by so many things. Bacteria, fungi, viruses, even a bad reaction to meds or heavy metals.
It's a surprisingly long list.
It is. And some forms of meningitis, you got to treat them fast. It can be life-threatening if you wait too long.
Absolutely, you have to act quickly.
So the doctor immediately orders a lumbar puncture. You might know it better as a spinal tap.
Right, to get a sample of that cerebrospinal fluid, the CSF.
Exactly. Think of it as like getting a window into the central nervous system. See what's going on in there.
Yeah, it's crucial for figuring out what's causing those meningitis symptoms.
Totally. So they send Cora's CSS off to the lab for a whole battery of tests. First up, they do a visual check, looking at the color, how clear the fluid is.
Like, is it cloudy or bloody?
Right, anything out of the ordinary.
Basic, but important.
Then they put it under a microscope, counting the red and white blood cells.
Yeah, looking for anything unusual, any weird cells lurking around.
Exactly. And of course, there's the Gram stain.
Ah, good old Gram stain.
Classic microbiology technique. Give us the rundown. How does that one work?
Sure. So basically, the Gram stain uses these dyes to tell different types of bacteria apart. It all comes down to the structure of their cell walls.
So some bacteria, they hold on to the dye and turn purple. Those are Gram positive.
Right. And the ones that don't, they end up pink Gram negative.
It makes it easier to narrow down the suspects.
Definitely. Though even with bacterial meningitis, the Gram stain doesn't always catch the culprit. It's like 80% effective at best.
Interesting. So you're saying it's not foolproof.
Not at all.
So in Cora's case, that initial Gram stain, it comes back negative. No bacteria spotted.
Huh. Interesting.
But here's the thing. The doctor decides to start her on antibiotics anyway.
Really? Why? You'd think they'd want to wait for more conclusive results.
Well, with meningitis, it's better to be safe than sorry. They don't want to risk delaying treatment while waiting for more tests to come back.
Yeah, especially if those symptoms are severe. Meningitis can progress so quickly.
Exactly.
Yeah.
So while she's on the antibiotics, they also send a sample of her CSF for culturing. Basically, try to grow whatever bug might be in there.
Right, see if anything grows in the petri dish.
But that takes time, right?
Oh, yeah.
It could be several days for those microorganisms to multiply enough to be identified.
So everyone's waiting, hoping the antibiotics will do their thing.
Must be a tense few days.
Totally. But a couple of days pass, Cora's not getting any better. And then those CSF cultures, they come back. Negative.
Negative. So no bacteria, no fungi.
Nothing. If it's not bacterial or fungal meningitis, what could it be?
Viral meningitis.
That's what you'd think, right?
Yeah. Seems like the next logical suspect.
But Cora's case is about to take a turn. A really unexpected turn.
Oh boy, this is where it gets interesting.
You have no idea. Last we heard, Cora was getting worse, and those negative culture results, they really threw a wrench in the works.
Not the news you want to get.
So no bacteria, no fungi. It's not looking like a typical viral infection either. What happened next? Well, the doctors, they weren't giving up. They ran even more tests on Cora's CSF, trying to get to the bottom of this.
Yeah.
The results were, well, pretty baffling.
Oh, that doesn't sound good.
No signs of the usual inflammation you'd see with the virus. But there was this one thing. They found high levels of a protein called 1433 protein in her CSF.
1433 protein. That's a mouthful.
Yeah, it's a bit of a weird one. Basically, it can be a sign of brain cell damage.
So like a red flag that something's seriously wrong.
You're right. But on top of that, they did an EEG to check her brain activity.
Yeah, I've heard of those.
And the patterns they saw, they resembled what you'd see in some neurodegenerative diseases like Alzheimer's or Huntington's.
Wait, hold on. Alzheimer's. But Cora's decline has been so rapid.
I know, right? That's what made this whole case such a head-scratcher. It didn't fit neatly into any of the usual categories.
So what did they think was going on?
Well, putting all the pieces together, the symptoms, the test results, how fast things were progressing, the doctor came to a pretty unsettling diagnosis.
I'm on the edge of my seat here. What was it?
Creutzfeldt-Jakob Disease. CJD, for short.
CJD. I've heard of it, but honestly, I don't know much about it.
It's incredibly rare and really, really scary.
What makes it so different from, say, meningitis?
It's not caused by the usual suspects. Not bacteria, not fungi, not even a virus. CJD is caused by something called prions.
Prions. Those are the things that cause mad cow disease, right?
Exactly. Bovine spongiform encephalopathy, or BSE, it's all in the same family of diseases, the transmissible spongiform encephalopathies.
So prions, they're like some supervillain of the microbial world.
They're pretty bizarre. They don't even fit into the normal categories of living things. Think of it this way. Prions, they're just proteins. Misfolded proteins.
Misfolded.
Yeah, like imagine a protein is like a piece of origami, carefully folded into this specific shape. But sometimes that folding goes wrong. The protein gets all crumpled up.
And that's a prion, a messed up origami protein.
Basically. And these misfolded prions, they can cause other healthy proteins to misfold too.
Kind of like a chain reaction.
Exactly. And as those misfolded proteins clump together, they start to cause serious damage in the brain.
This is blowing my mind. So a tiny little misfolded protein can cause all this havoc.
Yep. It all comes down to shape. The shape of a protein determines its function, and if that shape goes wrong, things can get really bad really fast.
So with Cora's diagnosis of CJD, does that mean her brain is basically being attacked by these prions?
Sadly, that's what's happening, and there's no cure for CJD.
That's just heartbreaking.
It is. Once the diagnosis is made, the focus shifts to managing her symptoms, making her as comfortable as possible.
This whole story is so sad, and honestly kind of terrifying. If a tiny misfolded protein can do all this, it makes you wonder what else is out there.
There's still a lot we don't know about prions and how they work.
Okay, so how do people even get CJD in the first place? It's not like you catch it from someone coughing on you, right?
Right. It's not contagious in the usual sense. There are a few ways it can happen. Sometimes it's linked to exposure to brain or nervous system tissue from someone who's infected, like eating contaminated meat.
That's scary.
There have also been rare cases linked to contaminated surgical instruments, or even from cornea or growth hormone transplants where the donor unknowingly had CJD.
Wow, so it can be transmitted even if it's super rare.
Yeah. But the majority of cases, they're what we call sporadic.
Sporadic, meaning what?
It means they just seem to pop up out of nowhere. No clear cause, no identifiable risk factor, like with Cora.
So frustrating. No way to predict it, no way to prevent it.
That's part of what makes it so challenging to study and treat.
I'm curious, though. You mentioned earlier that the damage from those prion clumps, it's kind of similar to what you see in other brain diseases like Alzheimer's.
It is, and that's actually a really interesting area of research, the link between prions and other neurodegenerative diseases.
Okay, tell me more about that. We were talking about how the damage from those prion clumps, it kind of looks like what you see in other brain diseases like Alzheimer's.
Yeah, and it's more than just looks. It's that whole protein misfolding thing.
Right, but prions, those are just one specific protein. Right?
Yeah. But that same kind of misfolding and clumping, it happens with different proteins in other diseases too, like Alzheimer's, Parkinson's, Huntington's.
So even though those diseases have different causes, they all share that common thread.
Exactly. It's like different roads, same destination. In this case, the destination is neurodegeneration, and those misfolded proteins, they're paving the way.
That makes sense. So are researchers looking at prions to try and understand those other diseases better?
Oh, absolutely. They're trying to figure out if what we learn about how prions spread that misfolding, if it could hold clues for stopping similar processes in other diseases.
That's fascinating. So these super rare prion diseases, they can actually help us crack the code on more common conditions like Alzheimer's.
That's the hope. It's still early days, and there are definitely differences between the diseases. But that possibility, it's pretty exciting.
It really is. You know, it makes you realize how connected all these different areas of science are.
Yeah, it all ties together in the end.
You never know where the answers to the big questions are going to come from.
Exactly. Sometimes you got to look in the most unexpected places.
Well, we've definitely gone to some unexpected places in this deep dive. We started with what seemed like a simple case of meningitis, and ended up in this whole other world of prions and protein misfolding.
It's amazing how one case can lead you down so many different paths.
Cora's story is just a powerful reminder of how complex the brain is and how much we still don't know about these infectious agents.
It's definitely humbling. Makes you realize that even with all our fancy technology and research, there's still so much we're trying to figure out.
For sure. This whole deep dive has really given me a lot to think about.
It's always good to keep those brain cells firing.
Absolutely. Thanks for joining us on this wild ride, and until next time, keep those brains curious.